Welcome to a deep dive into the world of telemedicine,
Sounds intriguing.
specifically how it's revolutionizing emergency care in Africa.
Okay, yeah.
We've got some really fascinating research and some real-world stories
Uh-huh.
that really highlight how technology is bridging the healthcare gap
Yeah.
in some really incredible ways.
It's amazing to see how telemedicine is really stepping up to the plate,
Right.
and offering solutions to these challenges,
Exactly.
particularly in regions where, access to healthcare has been limited.
Yeah, and I think our sources
Mhm.
really kind of paint a stark picture of that reality.
Oh, yeah.
One study points out that Africa accounts for 14% of the global population
Wow.
and a disproportionate 24% of the world's
Mhm.
patients.
Mhm.
But get this, only 1%
Mhm.
of global healthcare spending is directed there.
That's a striking statistic.
It is.
And I think when you consider the doctor-to-patient ratio,
Right.
particularly in rural areas,
Yeah.
the urgency for innovative solutions.
Telemedicine becomes, even clearer.
Absolutely.
You really see why it's needed.
So before we get too far into these examples, can you just remind us
Yeah.
what exactly we're talking about when we say telemedicine?
Totally.
And maybe just quickly how it's applied in these settings.
Yeah, so at its core, telemedicine is about using technology
Mm-hmm.
to connect patients and healthcare providers remotely.
Right.
So you're thinking things like video consultations,
Right.
remote monitoring,
Sure.
sharing medical images and data for diagnosis and treatment.
So it's almost like bringing that doctor's office
Yeah.
to the patient no matter where they are.
Precisely.
Yeah.
It's that virtual bridge that connects those two.
Mm-hmm.
And the beauty of it, I think, is that it's adaptable.
Okay.
We're seeing it employed in all sorts of different ways across the globe,
Yeah.
from simple consultations to complex procedures.
Okay.
Take, for example, Nepal,
Okay.
the Bhutan hospital there.
Has a telemedicine center, which is supported by the Ministry of Health.
Okay.
And this now serves a network of 25 different regions,
Right.
bringing, specialized care to these remote communities.
That's incredible reach,
It is.
breaking down those geographical barriers.
Yeah.
What other global examples are there
Oh, tons.
that showcase this impact?
Yeah, I mean, one that's particularly remarkable is Ecuador's mobile surgery program.
Oh, wow.
Rural doctors there have 247 access to specialists through teleconsultations,
Okay.
and they've even integrated mobile operating rooms
Wow.
for patients requiring surgery.
Oh, my gosh.
It's pretty innovative,
That's incredible.
transforming surgical care in those remote areas.
It's like a high-tech medical caravan
That's a great way to put it.
going to those in need.
Yeah, bringing those essential services directly to them.
And then you have a country like Indonesia,
Yeah.
where they're using apps
Mm-hmm.
like Dokita and Dr. Gratis,
Yeah.
using technology to democratize
Right.
access to healthcare,
Exactly.
making it readily available,
Yeah.
particularly for those who might not have easy access to
Mhm.
hospitals or clinics.
Right. These platforms offer free teleconsultations, so basic healthcare advice
Wow.
is, much more readily available.
Okay, so we're seeing everything from remote consultations
Yeah.
to mobile surgeries.
Right.
The scope of this is incredible.
It is. And as technology continues to evolve,
Sure.
you can only expect even more innovative applications to emerge.
Totally.
But it's not just about the type of care that's provided.
Totally.
It's also about the speed and the accuracy
Yeah.
of diagnosis and treatment.
Sure.
Look at Scandinavia, for instance.
Okay.
Their ambulances are equipped with ECG devices
Okay.
that transmit data in real time to cardiologists,
Wow.
enabling faster interventions in, cardiac emergencies.
So for patients experiencing, heart attacks or serious cardiac events,
Yeah.
that real-time connection's got to be a game changer.
Absolutely. It can be life-saving.
Yeah.
And this concept of mobile real-time diagnostics is being used elsewhere, too.
Okay.
Take the mobile stroke units
Oh.
in Boston, Massachusetts.
Mm-hmm.
These units are essentially ambulances equipped with CT scanners,
Wow.
allowing for immediate diagnosis and treatment.
Like a mini hospital on wheels.
It is.
That's wild.
And, in time-sensitive emergencies like strokes,
Mhm.
that rapid response can mean the difference between a full recovery
Of course.
or, a lifelong disability.
It makes all the difference.
Yeah.
So these are
Yeah.
really advanced applications
Yeah.
that we're looking at. But
Yeah.
the core principles of this could be just as impactful
Oh, yeah, absolutely.
in less technologically advanced settings as well.
For sure.
So, for example, let's shift our focus to Nigeria,
Right.
where the Healthcare Federation of Nigeria, or HFN,
Mm-hmm.
is actively working
Yeah.
to improve emergency care. So let's kind of delve into what's happening in Nigeria.
Sure.
They're facing some similar challenges
Right.
to other regions,
It seems like.
despite being on a different continent.
Yeah.
Would you say that's accurate?
That's right. I mean, the HFN is tackling issues
Yeah.
that really resonate globally.
Okay.
Things like ambulance ramping and overcrowded emergency departments.
We've heard this before.
Yeah, exactly. These are bottlenecks that can significantly delay care,
Yeah.
especially in those emergency situations.
Makes sense.
Yeah.
So how are they approaching these challenges?
Well, they're taking kind of a multi-pronged approach,
Okay.
focusing on things like training healthcare professionals,
Makes sense.
enhancing infrastructure,
Okay.
and really trying to foster collaboration between different sectors.
Right, so it's a systemic approach.
Yeah, they recognize that these issues require, a systemic solution. It's
Okay.
not just one thing.
And you mentioned the Bank of Industry.
Yeah.
What role are they playing in this?
Well, the BOI is crucial here.
Okay.
They're investing in a variety of healthcare ventures,
Okay.
particularly those related to emergency response.
I see. So they're providing the resources.
Yeah, exactly.
Yeah.
They're the fuel for the engine.
Yeah. That's encouraging.
Yeah.
But where does telemedicine fit into all of this?
That's the big question, right?
How can it address these very specific challenges?
Well, imagine a scenario where you have a patient in a remote Nigerian village
Okay.
and they experience a medical emergency
Yeah.
without telemedicine.
Right.
Their options are limited.
Yeah.
They might have to travel long distances to reach a hospital.
Yeah. Which could be life-threatening.
Exactly right. Those delays
Yeah.
could be, further compounded by ambulance ramping
Right.
and overcrowded emergency rooms, as we talked about.
Right. Which kind of defeats the purpose
Exactly.
of even making it to the hospital in the first place if
Yeah.
you have to wait forever.
But with telemedicine,
Okay.
that same patient could connect with a healthcare provider remotely,
Okay.
potentially even while en route to a facility.
I see.
So that initial assessment could help triage the patient
Right.
and ensure that they're receiving the most appropriate level of care.
As quickly as possible so
Yeah.
it can help expedite
Yeah,
the triage process before they even get there.
that's the idea.
And that's crucial in prioritizing those who really need it.
Exactly. It's about leveraging that technology
Yeah.
to sort of bypass those initial bottlenecks
Sure.
and connect patients with the expertise they require.
Right.
Whether that's a general practitioner for initial assessment
Yeah.
or a specialist for, a more complex condition.
So it seems like we've laid out the potential benefits.
Yeah.
I'm curious about the practicalities.
Sure.
One of the sources that we've got
Okay.
is a research paper titled Modeling the Application of Telemedicine in Emergency Care.
Mm-hmm.
And it delves into the numbers.
Yeah.
And they actually run simulations
Mm-hmm.
to see the impact of telemedicine.
I see.
So tell me a little bit about that.
Yeah, this paper's really interesting.
Okay.
They use simulations to model different emergency care scenarios
Right.
and then introduce telemedicine into those models
Right.
to really assess its impact.
So they're running virtual experiments.
Yeah, kind of.
See how it performs in real-world settings.
Exactly.
What did they find?
Well, one of the things that really jumps out is
Yeah.
the potential for telemedicine to significantly reduce mortality rates
Okay.
in these emergency situations,
Right.
which makes sense, right?
It does, yeah.
Faster triage, quicker access to specialists,
Yeah.
more efficient allocation of resources.
Mhm.
All these things can contribute to better patient outcomes.
So it's about getting the right care to the right patient at the right time.
Absolutely.
And they also highlight a concept called the continuous queue model.
Yeah, that's a fascinating one.
Can you explain that one a little bit?
Yeah, imagine a line of ambulances
Okay.
waiting to offload patients at a hospital. Now, without telemedicine,
Right.
the order of those ambulances might not accurately reflect the severity of the patient's conditions.
Yeah, it would just be based on arrival time,
Exactly.
not the urgency of their needs.
Right. But with telemedicine, you
Right.
can remotely assess the patients
Yeah,
while they're still in transit,
makes sense.
allowing for dynamic prioritization.
So the most critical patient,
Yeah.
even if they arrived later, could be moved to the front.
Precisely.
That's fascinating.
It is. It's like having a virtual triage nurse
Yeah.
guiding that flow of patients.
Right.
And ensuring that the most critical cases get immediate attention.
That's a powerful application
Yeah.
of technology.
For sure. And while this particular study, focused on a specific context,
Mm-hmm.
I think its findings underscore the broader potential of telemedicine
Yeah,
to improve these emergency care systems.
especially in places like Nigeria.
Absolutely. I mean, especially in resource-constrained settings.
Right, where they're already facing these issues.
Right, exactly. Telemedicine could be a valuable tool for them.
It sounds like it could be a game changer.
It really could.
However,
Yeah.
we've talked about all this promise,
Sure.
but we have to acknowledge the realities of implementing it,
Right.
particularly in regions like Africa,
Yeah.
where infrastructure and resources can be limited.
Mm-hmm.
So let's talk about some of the challenges.
Yeah, the challenges are definitely there.
Okay,
I mean, cost is a major factor, right?
of course.
Setting up the necessary infrastructure,
Mhm.
equipping ambulances with technology,
Sure.
training healthcare professionals.
Yeah.
All of that requires significant investment.
It's about creating a whole ecosystem.
Exactly.
Yeah.
You can't just have the technology.
Yeah.
You need the whole support system around it.
And then you also have
Right.
bureaucratic hurdles to jump through.
Oh, for sure. Navigating regulations, securing approvals.
Right. All of that.
Yeah. Coordinating between stakeholders.
Yeah.
It can be time-consuming and complex.
It's easy to overlook that side of it.
It is, but those roadblocks are real.
Yeah.
They can really impede progress.
Absolutely. And then you have the technical considerations.
Yeah.
Making sure there's reliable internet connectivity in these areas
That's a big one.
can be a challenge.
Yeah, and maintaining the equipment and software
Sure.
requires ongoing support.
We can't just assume that infrastructure is there.
No, you can't.
And even if it is,
Yeah,
we're dealing with sensitive information.
right.
So there's the data security issues.
Absolutely. The data privacy is huge.
Yeah.
You can't implement telemedicine without it.
And then you have to think about the human element.
That's right.
Healthcare professionals have to be trained
Yeah.
to use the technology effectively.
And patients have to be comfortable with it.
Exactly.
You need buy-in from both sides.
It's a lot to consider.
It is. It's complex.
But it sounds like the
Yeah.
potential benefits outweigh
I think
some
so.
of those
Okay.
challenges.
Yeah, especially when you think about improving access to emergency care
Right.
and potentially saving lives.
It seems like it's worth the effort.
It is.
Yeah.
It's about building a sustainable system
Yeah.
that empowers providers and improves lives.
Okay, so we've talked about kind of the theoretical framework
Yeah.
and the on-the-ground realities.
Right.
I want to get into some concrete examples.
Okay.
You mentioned the Scandinavian telecardiology program
Yeah.
and the mobile stroke units in Boston.
Uh-huh.
Can you elaborate on those a bit?
Sure. So the Scandinavian program is a great example of how
Yeah.
real-time data transmission can really revolutionize things.
Okay.
The ambulances are equipped with those ECG devices
Right.
that transmit data directly to cardiologists at the hospital.
So they can already be looking at the data.
Exactly.
Yeah.
While the patient's being transported,
Wow.
the cardiologist is already analyzing their heart rhythm
That's incredible.
and preparing for their arrival.
That must make such a difference.
It does. It allows for much faster diagnosis and treatment decisions.
It's like having a cardiologist in the ambulance.
It is, in a sense.
And then the mobile stroke units.
Yeah, those are incredible, too.
Tell me about those.
So these are specialized ambulances that are equipped with CT scanners,
All right.
allowing them to diagnose strokes on the scene.
Which is essential.
It is. I mean,
Right.
time is brain when it comes to strokes.
Right.
The sooner you can administer treatment, the
Mhm.
better the chances of recovery.
So the ambulance becomes
Yeah.
a mobile diagnostic and treatment center.
That's right. It's remarkable how technology is changing things.
And those are just two examples of how telemedicine is being used.
Yeah, there are so many others.
Emergency care.
Telepsychiatry for mental health emergencies.
Oh, wow.
Remote consultations for trauma cases.
Yeah.
The possibilities are really vast.
So what does it all mean?
Well,
Where do we go from here?
the evidence is clear.
Okay.
Telemedicine has the power to transform emergency care, and especially in regions where access is limited.
Sure.
It's about creating a more equitable and efficient system
Absolutely.
where everyone, regardless of location,
Right.
can get the care they need.
But it's not a magic bullet.
No, it's not.
We need investment, innovation,
Mm-hmm.
collaboration
For sure.
to overcome these challenges.
Right. It's a journey,
Yeah.
not a destination.
But it's a journey worth taking.
It is.
This has been a really insightful dive
It has.
into this world.
Yeah.
So for our listeners who want to learn more
Sure.
about this incredible work
Yeah.
being done in Africa,
Mm-hmm.
where can they go?
Well, if you're interested in supporting organizations that are really making a difference,
Okay.
I encourage you to check out RescueRide Africa.
Okay. Great recommendation.
They're doing great work.
You can find them at RescueRideAfrica.com.
That's right.
Now, before we wrap up,
Yeah.
I want to leave our listeners with a thought-provoking question.
Right. Sure.
We've talked about the potential to improve access to specialists.
Right.
But what about the role of general practitioners?
Ah, that's a great point.
We often think of telemedicine as connecting to these specialized doctors.
Yeah.
But GPs are often the first point of contact.
They are, and with the right training and tools, they can leverage telemedicine to manage a surprising range of conditions remotely.
So instead of overwhelming specialists with every case,
Exactly.
you empower GPs to handle these more routine issues,
Right.
which frees up the specialists
Yeah.
to focus on the complex cases.
Exactly.
And that could lead to a much more
Yeah.
efficient and sustainable system.
It's about finding the right balance
Yeah.
between specialized and general care.
Mm.
And telemedicine can help us get there.
So it's not just about connecting to specialists.
Right.
It's about optimizing the whole system.
Exactly.
It's a great point to ponder.
It is.
Yeah, it really is.
It really highlights the potential for telemedicine to not just bridge gaps, but to, really fundamentally reshape how we deliver healthcare,
Absolutely.
especially in areas where resources are stretched thin.
Right, and it goes back to that question you raised earlier
Yeah.
about the role of GPs.
Yeah, what role can they play in all of this?
Yeah, we often focus on the specialist side of it,
Right, right.
but GPs are so important.
They are. They're often the first line of defense.
Yeah.
And with the right tools and training, they can do so much with telemedicine.
Totally.
Manage a surprising range of conditions remotely,
Right, so it's almost like they become these
Yeah,
virtual gatekeepers,
exactly.
making sure patients get care,
Mm-hmm.
but also filtering out the cases
Yeah.
that might not need a specialist.
It's about creating a more efficient system
Totally.
where, technology helps guide those decisions.
Especially in places like rural Africa.
Yeah, where specialist access is already limited.
It's like creating this network of virtual clinics,
Yeah.
extending the reach of that primary care.
Yeah, and allowing specialists to focus on those complex cases.
It just seems like it makes the whole system work better.
It does. It improves patient outcomes,
Yeah.
but it also, makes healthcare systems more sustainable.
It's a win-win.
It is.
Patients get better care,
Right.
and the system becomes more efficient.
Exactly.
So we've covered a lot of ground today,
You have.
talking about the need for these solutions in Africa,
Mm-hmm.
the different ways telemedicine is being used,
All over the world.
the challenges of implementing it,
For sure.
but also the amazing potential.
It's been a really fascinating discussion.
It has. So for our listeners who are feeling inspired
Yeah.
to get involved in this telemedicine revolution,
Absolutely.
especially in Africa,
Yeah.
where can they go?
Well, I can't recommend RescueRide Africa enough.
Yeah, great
They're
recommendation.
doing incredible work.
You can find them at RescueRideAfrica.com.
That's the place.
And remember, even small actions can make a difference. Well, on that note, I think that wraps up our deep dive.
It does.
Thank you so much for joining us, and we'll catch you next time.